Hey, welcome. Today, we're going to talk about something that's on everybody's mind when they think about retirement. And yeah, it can be a little stressful. We're talking about healthcare. It feels like it's full of unknowns, but I promise, by the time we're done here, you're going to have a solid game plan to turn all that uncertainty into real confidence.
So let me ask you a question right out of the gate. What do you think is the single biggest financial wildcard in retirement? I mean, you could pretty much plan for your mortgage, for groceries, even for that big trip you want to take. But there's one expense that is just notoriously hard to nail down.
And yeah, there's the answer. It is a huge number. Fidelity estimates that a healthy couple retiring at 65 might need over $300,000 just for their healthcare costs. But here's the real kicker. That massive number doesn't even include the biggest potential expense of them all, which is long-term care.
Okay, I know, a number like that can feel pretty overwhelming. But just take a breath. Panic is not a strategy, right? Our goal today is to flip that feeling of uncertainty into a clear plan that puts you back in the driver's seat. And by the way, if you want to play with these concepts for your own life, retirementaihelper.com has some really useful tools for that.
So let's just frame the problem. People call it the great unknown for a reason. Costs are unpredictable, they're rising faster than pretty much everything else. But you know what? We're not going to treat this like some big scary monster. We're going to treat it like a variable that we can absolutely plan for.
And your whole plan, it really starts with one thing: Medicare. Think of it as the foundation of your house. It's that solid base for Americans 65 and older, and it's your absolute first line of defense. But, and this is a really important but, it is crucial to understand that it does not cover everything, not by a long shot.
So if Medicare is our foundation, how do we build the rest of the house? Well, as soon as you turn 65, you're going to face your first major decision. And it seems really complicated from the outside, but it actually boils down to one fundamental choice about how you want to get your healthcare.
And here they are, your two main paths. On one side, you've got Original Medicare, which you pair with a supplemental plan called Medigap. You can think of this as kind of like your a la carte option. You get total freedom. You can see any doctor, anywhere in the country, as long as they accept Medicare. The trade-off is you'll pay higher monthly premiums, but your out-of-pocket costs when you actually need care are super low and predictable. Now on the other side, you've got Medicare Advantage. This is more like an all-in-one package deal. The monthly premiums are often way lower, sometimes even zero, and they usually roll in extras like dental, vision, and even gym memberships. The catch? Well, you have to stick to a network of doctors, and if you get sick, your out-of-pocket costs can be higher, though there is a yearly cap.
So you see the trade-off, right? It really boils down to this. Do you want to pay more each month for that freedom and predictability, or would you rather save on premiums and in exchange accept some network limits and the risk of higher costs if and when you need care? There's truly no right answer. It's completely personal. It depends on your health, your finances, and honestly, just what helps you sleep at night.
Okay, so we've talked about what Medicare can do. Now we have to talk about the single biggest thing it doesn't do. And folks, this is the real elephant in the room when it comes to retirement planning.
Medicare leaves some pretty big gaps. You know, things like routine dental work, glasses, hearing aids. Those usually aren't covered. But the one that can have the most devastating financial impact is that last one on the list: custodial long-term care. And let's be clear, this isn't skilled nursing care after a surgery. This is help with the basic activities of daily living, like getting dressed, bathing, or eating because of a long-term illness.
And what does that kind of care cost? Well, the median price tag for a private room in a nursing home right now is over $127,000 a year. That's a number that can absolutely decimate even a well-funded retirement plan in just a couple of years.
So you might be thinking, okay, but what are the odds I'll actually need that? Well, the government's data shows that about 70% of us turning 65 today will need some kind of long-term care in our lifetimes. Now, that doesn't mean everyone ends up in a nursing home for years, but the chance of needing some help is just too high to ignore. Hope is not a strategy.
All right, we've laid out the challenge. So enough of the scary stuff. Let's pivot to the most important part of this whole conversation: the solutions. It's time to stop worrying about the problem and start building your action plan.
And the really good news here is that you have options. There is not a one-size-fits-all solution for this. The whole key is to find the strategy that fits your finances, your family, and frankly, your own personal definition of peace of mind.
So how do people handle this potential cost? Broadly speaking, there are three main ways to go. First, you've got traditional long-term care insurance. You pay a premium, just like car insurance, and transfer that big financial risk over to an insurance company. Second, there are hybrid policies. These are cool because they combine something like life insurance with a long-term care benefit. The upside, if you never need the care, your heirs still get a death benefit. It's not a use it or lose it situation. And third, there's self-funding. This is for people with really significant assets who can comfortably earmark a large chunk of their portfolio to cover these costs if they ever come up.
Let's make this real. So, meet Alice and Bob. They've built a great nest egg, and their plan is to self-fund. They figure, hey, if one of us needs care, we'll use our home equity to pay for it. This can definitely work, but it's not without risk. A really long, expensive illness could eat through their assets and impact the financial security of the surviving spouse.
Now, let's meet Charles. His situation is a little different. He has a few chronic health issues and no kids nearby who could step in as caregivers. For him, paying that premium for an LTC policy just made sense. He's transferring the risk. It gives him incredible peace of mind to know that his costs are predictable, no matter what happens with his health.
So, what's the takeaway here? What does all this add up to? It's really about taking all these different pieces, Medicare, out-of-pocket costs, long-term care, and assembling them into one single, coherent plan that protects the future you've worked so hard for.
So let's boil it all down into a simple checklist. Here's your 4-step action plan. First, decode Medicare. Make that conscious choice between an Advantage plan or Original Medicare with a Medigap policy. Second, budget for all the other stuff, premiums, copays, dental. Third, confront the long-term care question head-on. Don't stick your head in the sand. Make an actual decision. And fourth, and this might just be the most important one, invest in your health. The best financial plan in the world is one that includes staying active and healthy for as long as possible.
Because really, at the end of the day, retirement isn't about hitting a certain age on the calendar. It's about readiness. It's about being prepared. You have spent your entire life working to earn this freedom, and this kind of planning, well, this is how you protect it.
If you feel ready to take that next step and build a roadmap that is completely tailored to you and your goals, go check out www.retirementaihelper.com. They have tools and guidance that can help you get started today.
So, I'll leave you with this one last thought. You have worked your whole life to earn your freedom. The only question left is, are you ready to build a plan that's going to protect it? I really hope this helped you feel more confident about getting started. Thanks so much for your time.